Welcome to Mom and Mind, a podcast about maternal mental health from conception to pregnancy and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. We discuss very real struggles that can sometimes be hard to hear, but these are stories that need to be told so that moms and families can know that healing is possible. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional. Thank you for being with us today.
Welcome back to Mom and Mind. I'm your host, Dr. Kat. I'm so happy to talk with Dr. Juli Fraga today about maternal mental health in the context of Asian cultures. We'll talk about some of the cultural challenges faced by the pregnant and postpartum mothers and how to better support their mental health. Dr. Fraga is a psychologist in San Francisco, where she specializes in maternal mental health concerns. She also co-facilitates a postpartum support group, the Afterglow, at UCSF, as well as a 3-week pregnancy support circle, the New Nest. Dr. Fraga is also a freelance health writer, and she's written about women's health concerns for Refinery 29, NPR, Quartz, Psychology Today, the Huffington Post, and the Washington Post. Thank you so much for coming on, Dr. Fraga. I'm so happy to talk to you.
Thank you so much for having me.
Yeah. So we can get started. I'd love to know about the work that you do and whatever you feel comfortable with sharing about how you got into this specialty, because I know you do so much and you've been doing it for a while.
Sure. Thank you so much. So kind of if I go back in time a little bit, even when I was doing like my master's degree in psychology many, many years ago, I always had an interest in women's health concerns. So back in the day, I don't know if they still have these on college campuses, but they had what was called like a women's health and resource center. So during my master's degree and my doctoral degree, I worked at the Women's Health and Resource Center, where I became involved in a lot of women's health topics. At the time, mostly topics that pertain to college-aged women. So eating disorders, body image concerns, having safe sex, topics that kind of fit around kind of that developmental kind of trajectory.
Right.
And then after I had my daughter in 2008, I realized that there was this whole kind of group right now of women and mothers that I started interacting with, and I started to learn more about maternal mental health concerns. So it was kind of around that time that I decided to do some specialized training in maternal mental health concerns and kind of re-angle the direction of my private practice.
Okay. You were already in practice or working in the field around that time?
Yep, I was.
Okay, great. And you've been in San Francisco. That's where I met you and know you from. And doing really a lot of great work there. Can you say a little bit about the work that you do with UCSF?
So I have a pretty small 2-day-a-week private practice where I see, patients, mostly pregnant women and new moms that are coping with postpartum depression, postpartum anxiety, career transitions related to motherhood identity, exploring mother-daughter kind of dynamics that reemerge during the postpartum period. I do some work with birth trauma, and then also some work around kind of, the loss of a parent, kind of motherhood loss and how that kind of comes up. So some brief work during pregnancy and new motherhood. And then I also work at UCSF, where I do a postpartum support group, the Afterglow, with my colleague and co-facilitator, Melissa Whippo, who is a social worker at UCSF. Melissa and I started the group 4 years ago, and we have a group that goes over 6 weeks, and we have a group of women, and we, explore a range of topics related to the postpartum period during our group. Largely, we talk a lot about mood concerns, partnering, transitioning, I guess, from being partners to becoming parents, returning to work, and just kind of a lot of the emotional challenges that motherhood brings. I think one of the things that makes our group unique is that while it is a support group, Melissa and I really try to kind of bring about kind of in a new way of thinking some of the more kind of, I might say kind of in psychology language, more like psychoanalytic topics that we know come up during new motherhood, kind of the presence of the baby as the third and what that means, kind of feelings around motherhood perfection, fantasies about motherhood and how those do not map, onto the psyche in the same way once the baby arrives. So we try to talk about those topics. So we try to make it, a rich and deep group, even though, we only meet for 6 weeks for an hour and a half. And in addition to the Afterglow, this past year, I also started more of a pregnancy support circle at UCSF, called the New Nest. That group is much different in that it's more psychoeducational.
Uh-huh.
We talk a lot about kind of mood concerns, kind of what you should look out for. Partners generally come so we can get them on board. Everybody gets a packet of, what to look for. What's the baby blues? After 7 to 10 days, if you're having these symptoms, then, check in for a maternal mental health screening, talk about how to, bolster support after the baby arrives. And then we do talk a lot about boundaries because I think that comes up an awful lot in new parenthood.
That's fantastic. What a great resource. Two great resources that are so needed. And sometimes people don't realize they need them until after the fact. So it's great that, you're doing this work. And I really hope that, people are understanding how important this is. So in terms of speaking specifically to Asian moms and Asian American moms, and there's a lot of cultures underneath that banner.
Of course, yeah.
So, and we won't be able to speak specifically to each culture and ethnicity underneath that banner, but is there a way we can talk kind of in generalities about what's unique during pregnancy and postpartum for Asian mothers and start there?
Sure. So certainly I want to start by saying, I so appreciate you recognizing that kind of Asian and Asian American covers, a large range of cultures and ethnicities. And certainly I don't want to speak on behalf of the overall kind of group as a whole, right?
Yeah.
But what I would say, certainly there are some more kind of just unique pieces, I think, that come up because of the culture. But certainly what I'd advise kind of any practitioner that's working with, an Asian or Asian American mother is to keep in mind her own individual background, by looking at, did she grow up in the United States, or is she an immigrant, or were her parents immigrants and she's the first generation here in the States, kind of taking into account all of those individual threads as well. But if I were to kind of speak about what is a unique aspect for many Asian mothers, I would say oftentimes it's just the cultural configuration of the family. So oftentimes in American culture, we have a more kind of individualistic view about family and family building. So that might mean, we think about once, you go off to college and you find a partner and you start to build your own family, you're kind of thinking about things. And when I say this word, I'm not meaning it to mean that somebody's selfish at all, but more kind of through a me-centric lens.
Yeah.
Kind of, what's best for my family, and not that you don't take into account kind of your parents and in-laws and other family members' kind of opinions, but you do so kind of after the fact in a way. Right? So I think what's unique oftentimes for a lot of Asian cultures is the more collectivistic nature of kind of family, and that it's not so kind of me-centric. So it's not just that I'm making a decision for the baby, but it's like I'm making a decision, and that's influenced and largely kind of, brought about by maybe what my mother thinks, right? What an aunt, thinks, what kind of elders in my family think. And I'm, thinking about it then as the collective whole, a lot of different members kind of working together. Another difference oftentimes is in American culture, after the birth of the baby, a lot of the focus goes towards the baby. In a lot of Asian cultures, and not just Asian cultures, other cultures as well, a lot of the focus still remains on the mother. So, there might be, in certain cultures, like a confinement period where the mom, due to cultural beliefs, isn't supposed to kind of really leave the house for 30 days, or her feet aren't supposed to, touch the ground without socks. She's supposed to only have certain types of warm foods, soups that are prepared by mom. And that's just very different, right, than the typical kind of American culture where, after you have a baby, they offer you ice water and they want you to take a shower. All of those kind of components that are embedded into birth culture in America may very well contrast against kind of what someone from, not just an Asian culture, but from another culture kind of believes and values. So
yeah, I mean, I guess in terms of, how long somebody has been here, if they're just newly here or they've been here for a while, they're second, third, fourth generation, that can all vary pretty greatly in terms of how they've integrated into the culture here versus how much they're keeping from home and from their elders, which, I think can create its own conflict Or
yeah, absolutely. Because sometimes there's a conflict where, family members are coming maybe from another country right after the birth, and it's in kind of conflict to what the new mother really wants. But she doesn't feel, like some of us to say that I really don't want you to come then. So, boundaries kind of come up.
Right. So from the mom's perspective, are there any particular pressures that they're feeling, things that may be unique or specific to them while going through pregnancy and postpartum, things that they are more likely worried about, that kind of stuff?
I don't know. I mean, do you mean when you ask that kind of things that they're more likely worried about in relation to kind of their pregnancies, or do you mean
what kind of pressures might they be feeling internally in terms of worries about themselves or their babies or their family, if that's appropriate?
Yeah, I'm not sure. I think some of the kind of concerns might kind of map onto more kind of with the difference in how a pregnant woman oftentimes might be treated if she, is not kind of from America or Western culture, right? So I think that sometimes can be feelings of misunderstanding, even around prenatal appointments. Maybe there's certain ways, that she wants to go around her prenatal appointments or put together her birth plan, for example. Maybe she wants, her mom or a family member to bring in certain soups, and she doesn't want to have a shower after she has the baby. All of these kind of cultural components that are very important to kind of transition into new motherhood. And yet, if a healthcare provider isn't kind of knowledgeable that that's a very important value, not just a preference, I think these women can feel kind of misunderstood and dropped. And I think that can maybe increase risk a little bit for, a mood concern, or certainly maybe birth trauma. Certainly we know women have a certain kind of sometimes template of how they anticipate their baby will come into the world. And so I could, certainly see that for, Asian and Asian American women, if they have a certain kind of way that they want their baby to come into the world. And that really means something kind of culturally as they embark upon new motherhood, and the healthcare provider just kind of dismisses it or says, yeah, put that in your birth plan. But then, that's not been communicated to other team members. So they're still offering, like a shower and ice water and doing all of these things that are kind of different from what the patient requested. So I don't know if that answers your question.
Yeah, it does. I mean, I'm trying to think in terms of like, what are her stressors, what things could contribute to the stress. And just like you were saying, could potentially develop in something more intense or more serious, like a birth trauma or depression or anxiety.
Yeah, I guess maybe are you asking more, there's certain kind of things that are unique for Asian and Asian American mothers that might be triggering of a maternal mental health concern that are different from what we might think for kind of women of the Western world? Is that
perfect? Yes.
So I guess, when we think of that, I certainly think of that cultural piece around the birthing process. I also think about the stress, family dynamic stress, just as there is family dynamic stress kind of with anyone, but I think it's especially can be more complicated or complex if it doesn't feel like it's okay to tell your mom, that you don't want her to come, or you don't want to, some moms, they, like any mother, they're like, well, when I had a baby, we did it this way. And, if there's a more collectivistic family structure and mom's like, when I had a baby, I didn't leave the house for 30 days, but then maybe the woman really does want to leave the house and it's important and vital for her kind of, well-being. And then she feels at a crossroads between kind of receiving mom's advice, but also doing what she kind of feels intuitively is good for her kind of well-being. So I think that can kind of be complicating. Also, I think, in some Asian and Asian American cultures, when you kind of encounter, let's say, low milk supply, for example, the way to go about that might be more through kind of more indigenous healing, taking some type of herbal remedies, maybe going to acupuncture and all of that. So I think if that's not largely kind of received and recommendations are made kind of, to take, certain medications that can be given here to raise prolactin levels, or things that are not in line with kind of this more holistic kind of lens, I think that could be triggering as well.
Okay. I'm thinking about who's listening, to us have this conversation right now. If there are providers listening, then there are certainly ways that they can be more sensitive and approach their patients or their clients, or, you know, even if it's a nurse coming through or anybody who's working with the mom, to really, like, it sounds like be curious about what the mom's practices are and honor that.
Absolutely. And I think it's just best to ask and to not make assumptions, you know, just as you would with anyone. And then really to kind of take what she says to heart, to not try to disabuse you're not going to disabuse somebody of their cultural values. You know, that's not being sensitive. So I think that's a really important thing, because that's something that I definitely have seen where a mother, you know, or a pregnant woman communicates something. And I've heard her healthcare, you know, some providers, not intentionally, but just might say, well, that's not the way that we do it here, you know. And so there might be certain things that, you know, are vital to one's kind of health that are different, you know, ultrasounds or, you know, getting an IV or something like that. I understand. And that then needs to be kind of explained as that being a piece of medical care that's important for the health of the mom and the baby. But, you know, certain things that one could be flexible on, I think it's wise to receive that and not say something like, yeah, well, that's not the way that we do it here. Or don't worry about that. It won't be a big deal. You won't be thinking about that, you know, after you have your baby or during labor. I think it's all around kind of the language that's used and the way the words are conveyed. Does that make sense?
Oh, totally. So there's like a lot of potential in that for a mom to feel dismissed or unheard, or on some level not being able to advocate for herself, or powerless anywhere along those lines on some level. But I guess I also wonder, in terms of, you know, the doctor-patient relationship type of stuff, if, you know, doctors are seen as authority figures, and how is that relationship perceived? Do you have any sense of that?
I think that just varies by person, you know, but I certainly do think that, like, in terms of listening to someone and kind of taking their, you know, advice to heart, that some, you know, women might agree because they don't feel like they could disagree.
Mm-hmm. Right.
And that it's important that somebody understands, like, that just because someone agrees, when you take into account their cultural background, that doesn't necessarily mean that they really agree.
Right.
You might want to just kind of probe a little bit more, or kind of say, you know, does that really feel okay to you?
Mm-hmm.
And give them permission to disagree.
So for moms who, specifically Asian or Asian American moms who are dealing with mental health changes, either in pregnancy or postpartum, what have you noticed are some of the barriers or difficulties in terms of them getting services and mental health support?
I guess, you know, I will be honest, and I will say I probably don't know exactly all of those barriers, because when I see women in my office or in my group, most of the women are very acculturated, you know.
Mm-hmm.
So even though, you know, maybe their parents don't see, you know, have certain views of therapy, they're very acculturated. And so they're, you know, making it to a group, or they're making it to a therapy appointment.
True.
I do know, though, that there's some newer research out, and I don't know the kind of reference off the top of my head. I can get that to you later, but that talks for the first time about different types of support for not just Asian and Asian American moms, but other women of color. And what they found is oftentimes, and I'm sure there are so many factors that contribute to this, you know, socioeconomic status, acculturation, lots of different where geography. Mm-hmm. But one thing that the study found was that these mothers were much more likely to feel cared for in their communities. So through their churches, mm-hmm. through more peer support groups, and maybe through education or through nurses that came to their house.
Yeah.
Which makes a lot of sense, you know, mm-hmm. in the sense of also more of a collectivistic kind of mindset. Certainly, like some of these women in the study, it's not that they were particularly religious, but they recognized that when they connected with people at their church, in their local community, these people provided exactly the help they needed, which was maybe watching the baby and giving them a ride to a medical appointment, mm-hmm. you know, or, you know, meeting with other moms to, you know, gather to have like a conversation about new motherhood, you know, by way of in the church community versus like at, you know, a new mom center or any of those types of places that other moms might gather. So.
Okay. Yeah, that's very helpful. I mean, that, right. So, I mean, I'm also very aware that we're still talking about a large group of women in very, very different cultures.
Offend anyone to say this is how it always is, you know, for everyone, because certainly every person, you know, varies. and what they're kind of looking for and with their own individual background.
Yeah. I mean, that's absolutely true. And I think that, one of the big points is to really ask and be curious and honor whatever it is that the mom is telling you that she needs. Sometimes we don't know what we need, and that's fine. But for the most part, it seems, that most providers, medical providers, it's a fast-paced environment. In a doctor's office or in a hospital, it's, not typical for them to sit down and take time. And
even keep that top of mind. I think for a lot of people, and not just this, Asian and Asian American population, but I think it definitely, what was I going to say? I mean, I think that it just kind of doesn't fall at top of mind because, they're not thinking about it. They're busy. And so it's just kind of, gets missed.
Right. So in terms of the, pregnancy or postpartum, are there other specific things for either providers to be aware about, or even moms, Asian or Asian American moms, to be aware about in terms of, well, I guess that's two questions. Let me take that.
I think one of the ways that healthcare providers can really be advocates is to make sure that through like hospitals, especially through like social work programs, that make sure that you have a sturdy amount of resources. Kind of keeping in mind some of this newer research that talks about moms that might connect. Don't push therapy if it's something that is so, kind of not okay culturally that the woman's never going to go. Maybe she's going to, because I've seen this happen. They, says she's going to go, but she has no intention of going. Maybe you need to find a window or a door,
right,
an opening in the community. And that person can then kind of serve as kind of, a step to help the person kind of get there. So I would say make sure to, work collaboratively with social work departments to make sure you're kept abreast of a lot of community resources.
Right. So either culture specific or language specific?
Absolutely. And then just also, looking in different neighborhoods, certainly looking at different programs that might offer, and this is probably only going to be in larger cities, but, like in San Francisco, we have like an infant parent program where a social worker goes to, a family's house once per week and then, has an appointment with the mom and the baby right in the comfort of her own home.
Mm-hmm.
There are certain criteria that women meet to kind of, have that service, certainly keeping abreast of different types of support groups and different communities, those types of things.
Right. Yeah, that's a good point. And, having been in San Francisco myself for a while, I know that there's quite a lot of resources for Asian families, more so than there are absolutely in the suburbs or somewhere else. So city centers are easier, but, not everybody lives there. So for people who have to be creative about resources, about getting culture and language specific resources, that's going to be a little bit harder for sure.
Absolutely. And certainly in, less urban areas, right? There are going to be more barriers to access that type of support. And so maybe those are places where you have to look kind of outside of the community. Are there ways to connect kind of through, even online platforms?
Mm-hmm.
Certainly if somebody's really at risk for, depression, or we don't want them to get treatment online, but is there a way to get some added support, in creative ways when you're not living in kind of a urban metropolis?
Right. Well, I guess I'm thinking then in those situations too, well, even in the urban metropolis, would it be beneficial to bring families in too? If you're even a medical provider, would it be useful if you suspect or are thinking there's depression or anxiety to request that the family members come in also?
I think it depends on a case-by-case basis. Sometimes, like I've certainly worked with like some, Asian patients where the mom came to the appointment. But then I've certainly worked with some patients where they didn't want their parents to know they were struggling at all. They didn't want to disclose that. So I think that just is a case-by-case kind of basis. And I think it's just really wise to never make like some assumption,
Right. So then the provider could be anybody. I mean, it could be an OB, it could be pediatrician, it could be a social worker, medical or mental health specialist. Is really it's on them on some level to ask a lot of questions.
Absolutely. Because we know that like OBs and pediatricians kind of are the gatekeepers, right? Kind of during pregnancy and the immediate postpartum period to kind of catch moms in a net, who are more at risk for depression, who are suffering from depression or anxiety, and then to help them connect kind of through the next step to a provider, a mental health provider.
Mm-hmm. In terms of other supports, just in general, supports for this community, what have you seen that's been beneficial?
I guess, it's a little bit hard for me to answer that question again, because when I see people write, they're probably pretty acculturated. So they're making use of the same services that other women who aren't, Asian or Asian American are making use of too. Right. So, but I would say probably more community supports.
Mm-hmm. Do you think it's important to have groups that are led by people who are culturally similar?
I think that it can be, but I don't think all the time. Again, I think that kind of cultural kind of similarity is something, I've certainly worked not just with moms, but certainly people before that wanted to kind of work with an Asian therapist. And so they came to see me. But just because I'm an Asian therapist doesn't mean, that I know about their particular culture. So they could have been kind of disappointed, or some people, it doesn't seem to kind of like make a difference at all. Mm-hmm. I guess that kind of comes down to an individual person. I would recommend, that healthcare providers work with their social work departments to find in the community culturally sensitive therapists, because some therapists, that's more of their specialty,
Mm-hmm. So right. They're already kind of ready to be aware.
And then certainly, kind of looking at different ways that people can heal. Maybe talk therapy, isn't for everyone. That's one form of healing. Mm-hmm. Certainly I know therapists like here in the Bay Area who do talk therapy, but they kind of include a lot of other types of healing practices into their work. So I think sometimes that can make someone feel a little bit more comfortable. Maybe it's meditation, maybe it's breathing exercises, maybe it's some type of yoga that kind of serves as the catalyst to move into more talk therapy.
Right.
The other thing that I would say that I have read about, I haven't experienced this in my practice, but I've certainly read, about cases where a woman really was suffering and she had severe postpartum depression, but because of family recommendations, she was taking herbs and she was going to acupuncture and she was doing all of these other holistic forms of treatment that just weren't touching the problem. And so she suffered longer than she needed to. Mm-hmm. And so in those instances, I really think when we see that, and if she connects with a medical provider, that's a case where, somebody it's absolutely needs to kind of jump in a pretty assertive way.
That's a really good point.
The help that she needs, because I remember maybe it was like at 2020 Mom Project. This was several years ago, but I think a woman spoke here from the Bay Area and she had really struggled, I think, with postpartum psychosis. But I think that, it wasn't diagnosed and caught for quite some time.
Right. And so there may also be different cultural understandings, one of what you're saying of how to treat someone who's feeling a certain way, but also how to make sense of it.
And I think language, I guess the other thing I would add is when we're working with, a patient and they come from a more collectivistic family, it's really important to watch the language that you're using with this patient. Mm-hmm. So it's really important to be inclusive of that collectivistic language. For example, instead of saying, oh, so when you take care of your baby or you're nursing your baby in the middle of the night, it means you're being a good mom. That's very, I would say, kind of individualistic. Uh-huh. Focused on mom and baby. A more collectivistic way maybe to say that is, so when you're feeding the baby in the middle of the night, you're doing this in your breastfeeding, you're being a good mom and you're being a good daughter. Uh-huh. Right. To kind of bring in, and I'm not like giving the best example of how that might come up. I'm giving a good example of how to incorporate it in your language in the way that you talk about things. And also because some parents, right? If a parent is an immigrant, they have different ways of expressing affection. It might not be through the words, I love you. Right. It might be through action. And so kind of also on the flip side of the coin. So what do you think, when mom makes you these soups and she comes over, is that a way that she's saying that she loves you?
Right.
So I think that that's pretty important, that the provider watch the language that they're using.
That's a really, yeah, absolutely. That's a really great point. Yeah. That's sort of what I was like looking for.
Maybe that's what you were trying to get at.
Yeah. Thank you for helping me get it, the words out and the question out and answer. Yeah. There's just all these nuances to other cultures that people who are born and raised here, even if they're from, like you were saying, from the same culture, but acculturated here, maybe missing or not taking as important.
And I guess the thing that sometimes I see oftentimes, across the board, not just in healthcare, but since we're talking about healthcare, I'll talk about it here, is that people learn about diversity or cultural sensitivity and they learn it as information, but they don't know how to put it into practice in a sensitive way. So it merely stays as information and there's a lot of missteps. So,
right.
The example I gave with language is certainly a good example. Like someone might have that information, but if you take the human out and it's still conveyed in a way that is othering, it's not going to go anywhere.
Right.
So that's the other piece that I would add, because I've seen that certainly in healthcare where someone might have gone to a cultural training and then they kind of think all Asians are like this or all African-American patients are like this. And so they might use language unconsciously that's totally insensitive. Well, I know that you people really prefer ... That's
Right. That's a really good point. Yeah. There's an effort there, but you're missing it a bit. And potentially creating a further divide.
Absolutely. Creating a further divide and shaming someone, not intentionally, but shaming someone because of not recognizing that that information is about a person and it still needs to be taken into account. The best way, to become more culturally aware and sensitive is through our being and through kind of doing things, not just in, reading things off PowerPoint slides at a training.
Right. Very good point. Yeah.
But sad but true. There's a lot of people, there might be those types of trainings in healthcare and then they think that that's enough because they're told that that's enough, but it's not enough.
Right. Right. And that's part of the reason why I think it's useful to have these discussions is that it brings to life some of this other stuff where you can get a little bit more in depth. It's not just on a slide and here's what you should do. That we're getting into some of the nuances, but in a half an hour talk about this, there's no way we can touch on everything.
Absolutely. I think that there's a way even to do, other kind of podcasts looking at maybe a smaller detail along kind of the cultural, what my colleague Bindu and I kind of call the cultural kaleidoscope that can give a little bit more specific kind of answers. Because I feel like I'm being kind of broad stroke and I certainly don't be, insensitive by saying this always happens. Certainly it doesn't always happen.
Right.
It's important to take into account so many factors, just like we do, with anyone.
Absolutely. Well, I really thank you for your time and your perspective and giving some clarity to how we should be thinking in different perspectives in a different way to be helping Asian and Asian American mothers. And as we, stated, maybe overstated, this is, we're not speaking specifically about each different ethnicity within an Asian culture or each culture specifically, but really, I think it's important to have the broad and general discussions to raise awareness and just to have people thinking, even if what they walk away from today is okay, so these are the things I kind of need to keep in my awareness and be sensitive about, then great. Then maybe that person that you're going to go and help and that mom you're going to go help really feels heard and helped.
Absolutely. I totally agree. I think that maybe, as a way to convey information for somebody who hasn't thought about this. It's such an important topic.
Yeah. Okay. Now I just need 1 million hours so that I can get into every other very detailed discussion that I want to have. But I thank you so much for your time and your knowledge. And you're so knowledgeable about so many other things. You do a lot of really important work in this field. And I just appreciate being able to talk with you.
Thank you so much. No, thank you so much for inviting me. I really appreciate it.
Sure.
By joining us today and listening, you're a part of the growing community of people who are aware and concerned for mothers and families during this beautiful and sometimes very difficult time of life. Please take a moment to subscribe, rate, and review this free podcast so that Mom and Mind can be found by moms, families, and providers who will benefit from hearing our talks. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com, where you will also find links and information from today's episode. Thank you for listening and being a part of the Mom and Mind community.